Parkinson's disease is due to decreased dopamine in the brain. The symptoms usually begin on one side of the body. It often begins with finger or hand tremor. There is slowed movement or decreased ability to move. The steps become shorter. There's difficulty getting up from a seated position. They have a stooped posture, balance problems, muscle rigidity and stiffness, decreased ability to blink, smile, or swing their arms, low, slurred, or hesitant speech, and handwriting changes that appear small and difficult. We're going to begin with this Parkinson's patient. She was first diagnosed with Parkinson's disease 13 years ago. Her main complaint is she cannot walk and her body, quote, freezes up. Her eyes water frequently. Another big problem is constipation and flatulence, which she describes as severe. Her left arm contracts uncontrollably with motor spasms. She's got loss of her right arm motor skills. She's got obsessive compulsive disorder and anxiety attacks. She can't concentrate and has difficulty speaking. She happens to be a nurse. She suffers from depression. Her body gets very hot. She has weird dreams, chronic fatigue, and insomnia. She has right back and hip pain. Current meds are levodopa, Mirapex, and sleeping pills. Her TMJ report, which we take on every one of these patients, shows her right disc is medially displaced. She has severe loss of equilibrium and vertigo problems. She has bilateral TMJ clicking upon mandibular protrusion and painful to chew, difficulty swallowing, stiff necks, cervical crepitus when she moves her head left and right, inability to turn head to the left or right, bilateral shoulder pain, tingling, and numbness. This is Rose, a patient who presents with Parkinson's disease. She has been seen by 3 or 4 neurologists, right?
Yes.
And you've been examined by Johns Hopkins University.
Yes.
And they've all diagnosed you with Parkinson's
That's
disease.
Correct. Yes.
Tell the audience some of the symptoms you've had.
I have freezing when I'm walking. I have when the medication isn't working. I just can't walk across the room by myself. I have to hold on to things. I'm very weak and get fatigued. I have slow speech with just fine motor movement problems. Not able to wash my hair or brush my teeth or anything like that when the medication's not working. Little, very small writing where it's ineligible. It's not able to be read. Teary eyes, not able to speak. My cognitive level, I'm not able to actually function or focus on anything. Rigidity, my back is very rigid and sore. I get a lot of low back pain. Contractions, muscle spasms. My feet contract. I actually, my toes will crunch in and just flare out. Just a lot of spasms, muscle spasms, involuntary movement. I have some face pain too, facial pain, tingling in my shoulders.
How many years ago did this begin?
It's been about 13 years that it's all started.
13 years?
13 years ago. Yeah.
And what age were you at then?
About 47.
47, okay. And has it been getting worse over the past 13 years?
Well, the medication, and at first it just took all away my symptoms. I guess it's been really, the last 3 years it's been just progressively getting worse. And then last year I actually had to take off work and go on disability.
So the medications is not as effective now. It's losing its effectiveness.
It's losing effectiveness. It doesn't, like yesterday, it didn't work at all for me. I mean, I was just off all day long.
We are delivering the appliance now and putting in articulating paper to determine if one side is higher than the other. The patient indicates that her left side is a little bit higher than her right side. Okay, just sit there a little bit for a while. This is Rose, our Parkinson patient, who's received her appliance 6 days ago and has been wearing it ever since the last 6 days. And I'm reviewing her symptoms that she came in with, and we'll go over them one by one. She'll tell you about her ability to walk, whether or not that's improved. Why don't you?
That has improved a little. I don't feel like I'm as off balance as I was before.
Okay, that's an improvement in her balance. And she was saying her toes would claw up.
My toes are claw up, and that is less than that. It's less. Usually I would have that every day, and now I think I've had like a couple times since I've had the appliance in my mouth.
Okay. She was constantly constipated. And tell them what happened there.
Yeah, I was constipated awfully, and I noticed since I got the appliance, I've been going regularly every day now, which was never for me.
And what did you go before? Every 3 days, 4 days?
I go sometimes every 6 days.
Well,
and then I have to give myself an enema to actually, to be able to go.
Well, that's a big improvement.
That's a very big improvement. I was shocked.
Okay. And you had the loss of motor skills in your right arm and constant contraction of your left arm, and that's improved somewhat.
That's improved somewhat, yeah.
Okay. And your anxiety attacks that you used to have, how frequently did you used to have those?
I used to have them once in a while. I wouldn't frequently have them a lot. I would have them like maybe a couple times a month. But I haven't felt depressed or anything this week.
No depression, okay. Weird dreams? You used to have weird dreams?
Still have some dreams, but they're not as horrible as they were before. They've been nice dreams, actually.
And depression?
I don't feel like I've been depressed all week.
Well, those are pretty good improvements for just 6 days into treatment.
Yeah, really.
What we're doing today is modifying her appliance to compensate for any wear that she's had in the 6 days, and we're increasing its height to take additional pressure off the base of her skull. And we're going to, her appliance is in the laboratory right now hardening up in a pressure cooker, and I'm going to go back and retrieve it and fit it to her mouth and polish it up and discharge her for the day, and that's going to be her entire appointment. Rose returns after wearing her appliance for 13 days. She's been wearing it constantly and has been experiencing good results. She reports that her constipation has disappeared and has gone from a bowel movement every 6 days to becoming regular, at least daily or at the most every other day. Her concentration is better. Her dreams have gone from weird to at least pleasant dreams. Her experiences with her body getting very hot have gotten better. Chronic fatigue is better. She gets more done during the day. Her depression is better. Her anxiety attacks are less frequent in spite of much stress at home. Why don't you comment to the viewing audience how the past 13 days have been?
Well, it's gradually gotten better. Before I had the appliance in, my medication that I take for the Parkinson's was not working. I had more off time than on time, which left me rigid and a lot of back pain, and that still a little bit. I get that with the medication, but not near as often. My balance is a little better. I have more on time with medication, meaning I don't have all the symptoms of Parkinson's that I did before. Depression's gotten much better, and like the doctor said, before my constipation was off, I would have to give myself an enema to go. Now it's just like, it's changed. It's like more, just better, more frequent, and which makes me feel better. And all of that, I'm just feeling a lot better. My fatigue's I have more energy during the day. I'm able to do things like before. I couldn't go to the store without being afraid the medication would stop working, and I'd be in the middle of a grocery store and just like be rigid and a lot of freezing, and I don't have that fear anymore because I'm feeling better. So it's amazing.
That's a good first report, and I'm pleased with the patient's progress. We're modifying her appliance today, increasing the vertical dimension of it, and we'll show you that as soon as it comes back from the laboratory. Okay. Chop, chop.
Yes, I tried mine.
Okay, bite. Open. Okay, bite again, bite. Open. Okay, you can stop. Okay, chop, chop. Okay, which side's high now? The right side. Chop, chop. Bite tight. Okay. The right's still high.
They're the same now.
They're both even? Okay, bite. Bite. Okay. Okay, this is the of the appliance that we are going to leave the patient with at the end of this appointment. And we'll see her in another week or 10 days and see what the improvement has been over and above what it already has been. Okay, this patient has returned. She's been wearing her lower appliance for 1 month and 5 days. We completely rebuilt it today, and this is the end of today's appointment. Overall, that you're doing
Better, definitely better.
okay.